As we talked about the intro, a slant board is commonly used to stretch people's calves out, and that's really valuable, but we use it as a very integral part of our examination. So no matter who comes in, what age group, whether they're an athlete, there's a symptom, whether it's anywhere in the body, you might be thinking specifically foot pain, knee pain, and that's completely okay. We'll talk more about the biotensegrity relationship in later videos. Or if you're one of the senior populations and we want to ensure independence of activities of daily living, and that requires proper strength and range of motion. So when we use a slant board, we get a lot of valuable information on how symmetry or asymmetry will carry over whether you're playing a sport or independence of activities of daily living, as well as your symptom that you may be having. And of course, we want to prevent more symptoms than we actually reverse and treat. So we're gonna have our client come on in here. And if you would please just gently stand on this slant board. Again, it's very stable, very easy instructions. She has her feet in a great, perfect position. Make sure the feet are symmetrically pointed the same. You will see some people will compensate right away and one foot will be flared differently than the other. So she put her feet on there perfectly. And we have her just leaning up against the wall for perfect ideal neutral. So this is reproducible no matter if I do the exam or anybody watches, we'll get the exact same result. Do you have any pain while standing on this?
No.
Okay, how would you rate the tension? 0 meaning you have no tension at all, 10, it's very severe tension.
2.
Okay, so it's a 2. We do want, before we would go to another level, we want 3 or less. For sure. 2 is what we consider just kind of perfect. A tension of 1 or 2 is definitely passing the test. Gently step off, please. Now this was just level 2. She is an athlete, so we're gonna go up to level 3. Gently step back on. So this is going to be the height that is kind of in every orthopedic textbook is going to be the upper end of normal. We're not even looking at excessive flexibility here. We're just looking for that optimum range, whether we're looking for health in our life, not being predisposed to injuries, but as well as proper athleticism when we heel toe in gait, sprinting, open skilled sports. She's a tennis player. So if there's an asymmetry on flexibility, there's always going to be compensations throughout the body. So do you have any pain on this level?
No.
How would you rate your tension, 0 to 10?
4.
Okay, so now is it a symmetrical 4? So is the left side a 4 and the right side a 4, or are they off a little bit?
I think they are off a little bit. The right one is more tense.
Okay, so the right one is more tense. And I'm also going to check just to make sure her heels are not floating, and they are. So this is really important. She's strong, and so her connective tissue and tendons are pretty strong, but in a weaker person, this could be more painful. But even on level 3, on level 2, her heels were completely flat and weight-bearing. On level 3, she doesn't have much tension, but she is definitely, her heels are floating. And I even recommend taking a cell phone, doing just a quick shot of those because you can just keep it in a digital file. And all of these things become very tangible to the client in terms of how these asymmetries can affect whether it's their symptom, their sport that you're trying to help them with of getting better. And of course, if you're a clinician and you're doing this, this is going to have a big impact on the asymmetries that people have, because we absolutely want to catch these things as soon as possible, long before people become the shuffling old man and woman in church per se. They have had inflexibility and strength and inflexibility problems 20 years easily prior to having that lack of physical capacity. So this is our basic exam that we do. Of course, you can do stretching, strengthening exercises. We're gonna really pay more attention to the asymmetrical side. If you do soft tissue release, we're always gonna be looking for the side with more tension. We're gonna make those corrections. Even if the person still reaches inflexibility levels, we would rather have you symmetrical inflexibility and then progress to what our goals of normal is going to be. But everybody out there, enjoy using this for stretching, but also this exam, which is going to give you a lot of insight.